I'm starting right now. Hello everyone. I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Now we will be studying about the parathyroid segment. Okay. In this we will be covering about the hyperparathyroid and the hypoparathyroid. So let's just begin. And in this you will be getting a short note. Okay. From this, it is expected that you will be getting a short note. Let's start. First we have is hyperparathyroidism. So if I tell you the definition, so anything hyper means there is excess. Okay, there is excess. Hyper means there is excess. Now parathyroidism, what is parathyroid? We have a parathyroid gland, like parathyroid hormone we have. So there is excess in the parathyroid hormone secretions, which results in what? Which results in hypercalcemia. Okay. And when there is hypercalcemia, there is increased amount of calcium. What will happen? As a result of which there is bone resorption. So these are the things which you need to keep in mind. Next, you have the types of hyperparathyroidism. Let's see what are the types that are available. First thing you have is if I tell you about the types, first one you have is the primary. Second one you have is the secondary, and third one you have is the tertiary. So there are three types. In the first one, what happens? In the first one, you will be dealing with the parathyroid gland. Parathyroid gland pathology. Like all the adenomas, what are the hyperplasia we have, we will be dealing with that segment. In the secondary, what we'll be dealing with? We have the compensatory hyperplasia. And see guys, if you are not aware about these terminologies, I would suggest you what you should go to your journal pathology lectures. There in detail we have covered about the hyperplasia and the hypertrophy segment. So please go and watch that video first. In the tertiary one, you have the autonomous hyperfunction. There is autonomous hyperfunction. Now let's see what is the normal physiology we have. In the normal physiology, what we need to understand is this parathyroid hormones is secreted by the chief cells. It is secreted by the chief cells of your parathyroid gland, Next, where they act? So they act on your bones, they act on your kidney, and they also act on your intestines. Okay. Now what happens is there is increased in the level of serum calcium. So calcium plays a very important role in your parathyroid hormones. Okay. If I talk about the etiology of primary hyperthyroidism, what is the etiological factors you have? The first one that you have is your what? You have your parathyroid adenoma. So guys, I have told you that whenever the term adenoma comes, this means we are dealing with a case of tumors. Okay. So adenoma means tumors. And they are most common. It accounts for almost 80 to 85% of the cases. Next you have is the parathyroid hyperplasia. And the next one you have is the carcinoma. Next accounts for your genetic syndromes. Let's see about the pathogenesis of your primary one first. So in the primary, what you need to remember first is there is overproduction. Overproduction of your parathyroid hormones. There is overproduction of your parathyroid hormone, as a result of which what happens guys is there is increased level of your bone resorption. increased level of your bone resorption. Now what will happen? Now there will be increased renal tubular calcium resorption. So you are understanding this pathology that we are following, right? Next you have is the secondary hyperparathyroidism. So they are caused by your chronic hypocalcemia. What happens, guys, in this case is there is chronic renal failure. There is chronic renal failure. After chronic renal failure, there is phosphate retention. Phosphate retention. As a result of which, what will happen? There is vitamin D deficiency. As a result of which, there is vitamin D deficiency. Now next, guys, you need to know about the tertiary hyperparathyroidism. So now tertiary obviously will occur after secondary. So if there is a long history of what? Long history of secondary hyperparathyroidism. Okay. If there is a prolonged history of secondary hyperparathyroidism, there are chances that the person will develop the tertiary also. So here, guys, what happens? The glands become autonomous and they secrete excess amount of parathyroid hormones, which are common in patients who are having renal failure or who are having a long-standing kind of disease. Any long-standing disease, mainly in long-standing renal failure. So guys, this is the pathophysiology summary. Let's just see that also. In the primary one, you have what? You have increased level of parathyroid hormone, increased level of calcium, as a result of which there is decreased level of your phosphate. In the secondary one, there is increased level of parathyroid hormones and decreased level of your calcium. In the tertiary one, you have so much increased level of your parathyroid hormones and there is increased of calcium as well. Then you have the chronic PTH excess. There what happens is there is bone resorption. So what I suggest you is, guys, just make a table of primary, secondary and tertiary and just write down the key points. Okay, just write down your key points. Now the clinical features. So clinical features, you can remember it with a mnemonic. You have stone, bones, groans, thrones and physical moans. Okay, so stone means there will be renal calculi. There will be renal calculi. Now why these renal calculi? These renal calculi are due to your hypercalciuria. They are due to your hypercalciuria. Next one, you have bone. So there is bone pain. There is bone pain. Like there are chances that the person will develop fractures. Groans means there will be abdominal pain. Abdominal pain. And thrones mean there will be polyuria and polydipsia. Physical moans means there is depression. The person will feel so depressed and there will be fatigue and confusion. Okay, so these are the clinical features which you need to keep in mind. What are the skeletal manifestations? Like what are the bone manifestations we will be having? We will be having the fractures, I have already told you. Then there will be bone pain. Then after the bone pain, there will be what? There will be osteitis fibrosa. Okay. What are the renal manifestations? In the renal manifestations, you will be having a nephrolithiasis. Nephrolithiasis are due to the calcium. They are your calcium stones. Next, there will be chronic renal failure. What are the GIT manifestations? You can remember it with the mnemonic of PPC. Okay, PPC. What are the PPC you have? Peptic ulcer. Then there will be pancreatitis. Then there will be constipation, nausea and vomiting. Nausea and vomiting are evergreen side effects, right? But if someone will ask you the side effect of antiemetics, you don't have to reply them that it is nausea and vomiting. Okay, antiemetics are given to prevent nausea and vomiting, so they are not the side effects. Next you have is the neuromuscular manifestation. In the neuromuscular manifestations, there will be muscle weakness. After that, there will be hypotonia, depression, confusion and coma. Confusion and coma. So these are basically the 5 manifestations which you will be having. Let's come to the CVS system. In the CVS one, there will be hypertension. The person will be having severe BP. Then on ECG, you are able to see what? On ECG, we are able to see that the QT interval has become short. So there is a mnemonic that QT is choti. So QT interval is short. Then you will be having irregular heart rhythms, or you can say irregular heart sounds. Okay. What are the investigations we will order? First thing that we will order is your serum calcium. So in the serum calcium, we will see that it is increased. So increased parameters are your serum calcium. Then you will be having serum parathyroid, which will be increased. Urinary calcium will be increased. And your alkaline phosphatase will be increased. The only parameter which is decreased is your what? Is your serum phosphate. Is your serum phosphate. Okay. So guys, this is the thing that you need to keep in mind. In the imaging studies on X-ray, I am able to see brown tumors. On X-rays, I am able to see brown tumors. Then on USG, I am able to see the parathyroid adenoma. Parathyroid adenoma. Then we have a special scan by the name of 𝗧𝗲𝗵𝗵 scan. So this scan, basically what it do is it identifies the parathyroid tissue. Okay, it identifies the parathyroid tissue. In the histopathology, in your adenomas, you are able to see what? You are able to see the chief cells. You are able to see the chief cells. Then there will be hyperplasia of all the glands. All the glands will be enlarged. Next you have is the carcinoma. So it can be either capsular or it can be vascular in invasion. Complication. Let's come to the complications. What are the complications we will be facing? There will be osteoporosis. You know osteoporosis, right? Osteo means bones and porosis means that there is pores. Then next you will be having pancreatitis, peptic ulcer disease, and there is cardiac arrhythmia. There is cardiac arrhythmia. Just remember the four most important. Okay. What is the treatment? So for the treatment, we follow a proper protocol. For the primary, we have the surgical removals of adenomas. Just remove the adenomas. For the secondary, you have to treat the underlying cause. Whatever the underlying cause is there, like if the underlying cause is that the patient is having vitamin D deficiency, so I will treat that. So I will be treating the underlying cause, like your vitamin D deficiency. Tertiary, in tertiary I will do a subtotal parathyroidectomy. So guys, this was all. Let's just see the summary. This is your summary table. Okay, let's just see that in primary there is increased level of parathyroid hormone, calcium, and decreased level of your phosphate. In secondary one, increased level of parathyroid, decreased or normal level of your calcium, then there is increased level of your phosphate. In the tertiary you are having, there is increased level of your parathyroid hormones, increased level of calcium, and increased level of your phosphate. So guys, just try to make a summary table at the end of the topic also. Next, we will be dealing with hypoparathyroidism. So, hypo means less. So, hypo means there is, first, hypo means less. Parathyroid means there is decreased or absence level of your parathyroid hormones. Which leads to what? Which will leads to hypocalcemia. Which leads to hypocalcemia. Now let's see what's the normal role of your parathyroid hormones. We have seen in the earlier video also that there is increased level of your serum calcium level and there is decreased level of your serum phosphate. As a result of which what happens is it acts on your bones, it acts on your kidney and it acts on your intestines. Guys, see, just remember this thing very properly. Okay, the functions of parathyroid glands are important. They can be asked as a short note separately also. So what are the types we have? If I talk about the types that you have is your congenital, acquired, and your pseudo hypoparathyroidism. Okay. So, what in congenital? In congenital, I am able to remember my 𝗲𝗏𝗃 syndrome. In the acquired one, I am able to remember the autoimmunes one. And in the pseudo, I am able to remember that there is the target organ resistant. If I talk about the etiology of the congenital one, in 𝗲𝗏𝗃 you have 22q11 deletion. And also there is defect in the third and the fourth pharyngeal pouch. Which will leads to what, guys? Which leads to your very famous thymic hypoplasia. Thymic hypoplasia, just remember this. What is the etiology of your acquired one? There is surgical removal during your thyroidectomy, which is the most common cause. So, most common cause of your acquired one are the surgeries. Then you have the neck irradiation. Okay. Next you have is the infiltrative disease. What are the infiltrative disease? Like your Wilson's disease. And I will not tell you again and again. Just go and revise the renal section. There I have mentioned about the Wilson disease. Just go there and watch that part. Okay. Next you have is the pseudo hypoparathyroidism. So what happens over here is there is end organ resistance. To your parathyroid hormones, which will leads to the genetic defect, and it is also associated with your Albright hereditary, Albright hereditary syndromes. What happens over this syndrome is the patient is having short stature, there is short metacarpals and a round face, just like my face. So in the pathophysiology, what happens is there is decreased level of your parathyroid hormones, as a result of which decreased level of your bone resorption and decreased level of your serum calcium. What parameter is the only parameter which is increased over here? So the only increased parameter I am able to see that there is increased serum phosphate. There is increased serum phosphate. Whenever you are studying, just try to remember the odd one. Okay, like here the odd one is there is increased level of your serum phosphate, that I will remember for sure. So what are the clinical features? In the clinical features, just remember that there is what? There is paresthesia around your mouth, around your hands and around your feet. Next, you have a carpopedal spasm. Now guys, listen to me very carefully and see me very carefully. I will be demonstrating two signs to you. First one is there is chopstick signs and the second one is there is trousers signs. So what happens in the chopstick signs is there is facial twitching. Like if there is a person who are having this kind of features whose facial nerve is damaged, so whenever I will tap on the face, they will be doing like this. Okay, there is facial twitching in this patient. Normally, if I tap, nothing will happen. But if the person is having this kind of feature, there will be facial twitching. Next thing, the trousers sign. See, like if I put the B cuff over here and if I try to inflate the cuff. So what will happen after inflating it, after some times, my hand is normally like this. If the person is having this kind of sign, the hand will become like this. Okay, the hand will become like this. This is called as your trousers signs. What are the clinical manifestations? First one, there will be cataract formation. Second one, there is basal ganglia calcification. Third, there will be dental abnormalities. And there will be anxiety and depression. So guys, these are the signs. In the CVS, I am able to see on ECG, there is prolonged QT interval. And there is congestive heart failure in severe cases. What are the laboratory findings? Now I will find the odd one out. Okay. So there is decreased level of what? Decreased level of your serum calcium. Okay. Decreased level of your serum parathyroid and decreased level of your urinary calcium. Increased level of what? Increased level of my serum phosphate. Okay. In the imaging, I am able to see there is basal ganglia calcification. Basal ganglia calcification. And there is dental hypoplasia. There is dental hypoplasia. What are the complications that can be there? There will be laryngospasm. And there can be seizures. Seizures in patients who are having severe hypocalcemia. Cardiac arrhythmia. Next, what are the treatment? So in the treatment, I will give the patient IV calcium gluconate. Then there should be continuous cardiac monitoring. And there should be correction of magnesium deficiency. What are the long-term treatment I should give? I should give them oral calcium supplements. Then vitamin D analogs and thiazides diuretics. What are the preventions that we should follow? We should preserve the parathyroid gland. We should preserve the parathyroid gland during the surgery. And autotransplantation of parathyroid tissue. What are the differential diagnosis in the DDs? I am able to see that there will be hypocalcemia. Then there will be hypomagnesemia. These are the differential diagnosis. Okay guys, this is your high yield table. So most common causes, the surgical removal during your thyroidectomy. Then you have something called as your Dschight syndrome. Then remember about the pseudo hypoparathyroidism. Okay. In the summary also, just remember first there is decreased level of parathyroid hormones, as a result of which there is decreased level of your calcium and increased level of your phosphate. In the treatment, what you will give the patient? You will give calcium plus you will give the vitamin D supplements. So guys, this was all about this chapter. If you have any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you so much.